Hello, good people. Emmanuel Science Safari bring you the Promise Insurance Show. And today we want to start with this package called the J Junior package that was recently launched by this company, Jubilee Health Insurance Company. And let's look through how it starts. But before going to it, let me start with this small video that actually interested me to research more about it. Let's listen in.
It's an honor for me to stand before you today at this groundbreaking event where we are adding onto our suite of products a new health insurance product which we have billed J Junior Medical Insurance. So some may be wondering what informed our decision to come up with this product. As you would agree, it is our children that we have to nurture to take our places to be more productive and hence to drive the economic agenda. As key stakeholders, we are encouraged by the progress towards universal access to medical care. As part of our company's effort to significantly reduce out-of-pocket expenses, we continue to innovate affordable products that meet the diverse needs of individuals.
That's interesting. Now, having gone through that, of course, you had the CEO's remarks, that is Dan Musime, talking about why we need to actually protect the out-of-pocket expenses, of which actually they affect the children so much. I have to commend Jubilee Health for coming up with this package because in the recent past, they have also introduced a package for the seniors who were for so long, excluded. Now, what is special about this J Junior is that it has also been the very first in the market to cover children by themselves. Before, a child had to be under a parent's cover. But you see, there are situations where some organizations, because they are cost cutting, they can only insure a set of staff. Now, the staff could also want to cover their children because for them, they already have the cover. But now, how would they go about it? So this was the solution about it. J Junior. So what are the benefits? 5 levels of comprehensive cover with optional benefits being the outpatient, dental, and optical. So the main cover, the inpatient. Inpatient is hospitalization that we talked about some time back. Select the plan and options to suit your medical needs. Then the budget, of course. Then cover for pre-existing and chronic conditions, psychiatric, congenital, even HIVs, children. You can also cover them as long as they have told us this information in advance. Countrywide provider network, referral treatment outside of Uganda, cover for inpatient and dental and optical treatment, then post-hospitalization benefit, and then family benefit. So let's look at what are the rates. Before going into the rates, of course, now this is Jubilee. I'm giving them some kalango. I hope they will be able to engage more with their audience. So let's look at, when you're looking at in medical insurance, you have to look at what is the benefit, what is the limit. So it's called the limit per annum. So there is the classic option. This is the very lowest package to the highest, which is royal. So the lowest covers inpatient of 15 million shillings. For the year, and then outpatient 1.5 million, dental and optical 150. These are usually packages, and then last expense of 1.5 million. So for Premier, the inpatient doubles to 30 million, the rest remain as is. Maybe the dental also doubles to 300,000, the rest remain as is. Advanced also doubles from the Premier to 60 million. Then the outpatient increases by about 50% to 2.4 million. Executive, the benefit increases from 60 million to 90 million, increasing by 50%, 30 million. So optical outpatient also increases to 3 million shillings. Dental to 900,000, and last expense now also increases to 3 million. And then Royal is Yabalangila. This comes to 150 million and 4.5, and then 1.2 for dental and optical, and 3 million shillings for the last expense. That is Mabugo funeral, because whenever we are treating somebody, we know they can also pass away. So what are the inpatient benefits? Of course, we give you a breakdown, pre-existing conditions, psychiatric bed limits. All these are labeled within this brochure, and basically, for instance, psychiatric conditions, we give you a special limit, though it has to have a waiting period of about 1 year, but it is an extra on top of the 15 million inpatient. It goes to 3 million for the classic. It goes up to 15 million for the royal. Bed limits, generally, general ward. Here we can give you up to, for executive and royal, we can give you a bed limit for their children of up to 375 and 400,000 respectively. There are so many other details that I can't go into. Let's look at what people look out for. These are also the benefits for the outpatient, and then the dental. Of course, the service providers are more or less the same. I hope this is clear. But since people are pressed for time, they want to go straight into what is the cost going to look like. And these are, by the way, are basic, or these are standard rates for standard life. Now, depending on the condition, and we don't expect so many conditions from children, so basically this would mean that their premiums are averaging this premium. So for the classic, let's start with the classic option. You can see the premium allocation is 348,000. That is for the inpatient cover. Then for the outpatient, you can see the premium increases a little bit to 481,000. That's how we bill it, much as your limit is, so that, but that is the cover. But then the premium, what is the cost of the cover, is that. Dental is 587,000. Same thing with optical, because the packages, the premium is more or less the same. Last expense is 23,000. So in total, we can see the child, one child, the premium would be actually 970,000. We use the calculator. Here we can see, if we go, we use these computations, the same computations I've put in the values. For the outpatient was 348,000, for outpatient was 481, then 580,000 for the optical and dental, and then for the last expense, the total was 970,000. So for that, you can see, plus the taxes, the small tax that is there is what I call 0.5 training levy, 0.5% of the 970, plus the stamp duty. This is URA tax, 35,000. In total, that is 1,110,000. So that is quite affordable for this package. So the package is going increasing, much as you saw that benefits are doubling. Here you can see the premium is increased by about 230,000, and we can see here it's also increasing to about by about 400,000. Yes, from this first option, from the executive. So that benefits go on increasing for the standard lives. So the maximum premium we'll charge under Royal will be 2.5 million. That is for the year. So that said, what are the exclusions? Sometimes people may want to know what are the exclusions. Okay, of course, these are key to note. Premium exclusive with a 0.5 training levy, and then stamp duty. That is also very important. If you want to also cover COVID, if your child is susceptible to such conditions, you can increase the premium by, we usually charge 10% additional premium, or it can go to 50%, as we said. Earlier, we were charging 10%, but well, these are rare conditions. Okay, maybe also key to note here, we are saying Nakasero Hospital, the surgery, and Kampala Hospital will be added, included at an extra additional 20% of the base premium. So this premium, we shall have the service providers who are not usually there. But for the executive and diamond, those packages are possible for you to get them at no extra cost. Okay, general conditions. These are all included in the policy document. We can't go through all of them, but it is important. Of course, what happens at the end of the day, once you make payment, you will get a medical card, a letter confirming you are the policy document, and the list of service providers. So, really, with that said, what stops you from taking out a J Junior package? A very first in the market for these children who were actually excluded in the past. Because they were minors, they could not go into a contract with an insurer. But with this, I think this is going to be a very good development. Let me leave you with the closing remarks of the GM, or the CEO of Jubilee Health Company, to give you more confidence on why you need to take out this package sooner than later. I remain Emmanuel Safali, bringing you the Promise Insurance Show as we conclude this video.
It's an honor for me to stand before you today at this groundbreaking event where we are adding onto our suite of products a new health insurance product, which we have billed J Junior Medical Insurance. So some may be wondering what informed our decision to come up with this product. As you would agree, it is our children that we have to nurture to take our places to be more productive and hence to drive the economic agenda. As key stakeholders, we are encouraged by the progress towards universal access to medical care. As part of our company's effort to significantly reduce out-of-pocket expenses, we continue to innovate affordable products that meet the diverse needs of individuals.